In early February 2018, a small delegation from Alfred Health in Melbourne, Australia went across to Tanzania to visit Muhimbili National Hospital in the city's capital, Dar es Salaam. The purpose of the visit was fourfold. One was to visit Alfred staff member Libby White, who had been on secondment for 18 months up until that point in time, to provide some executive leadership advice and strategies for the senior leaders charged with leading the organisation, where that was possible, delivering a leadership development program, and then strengthening global partnerships, both with the local hospital, but other partners that they engage with as well.
The thing I'm really interested in is to see the development of emergency medicine in Africa, especially in Tanzania, which is supposed to be at the cutting edge of emergency medicine, seeing what we can do to help the people there, but also to learn from them, because it's a two-way communication, it's a two-way learning experience, and I'm really looking forward to learning from them because they will have a lot to offer us as well.
The thing I'm looking forward to the most is really seeing what we can learn from them, as well as clearly what we can bring and share with them. The questions they're asking around leadership, change management, and about sustaining change are, fantastic. So I'm really looking forward to seeing where they are.
I'm excited about the team travelling from the Alfred to Muhimbili National Hospital because Libby, as an Alfred employee, has been working there now for 16 months, and she's been doing some great work in Tanzania and representing all of us, I guess, in doing amazing work, and she's a wonderful nurse. It'll be very exciting to see her in that patch where she's been working and to share that experience and her enthusiasm. She's always so positive, and to see her working in that environment with the Tanzanian nurses and doctors will be fantastic.
So what I'm most interested in is getting a real sense of Libby's life in Africa and what influence she's had on the culture there, her influence on the ground, her influence in clinical and in leadership, in nursing, but also across the board within the hospital. Truly observing the culture and interactions between people there. I find it really fascinating just watching how people interact, and not necessarily what they're doing, but the why, about why they do things, and how they go about their daily life and their daily work and their daily social interactions.
So I'm going into this completely naive. I'm really looking forward to the trip ahead. I've got a great delegation from Alfred that I'm really looking forward to learning from as we do this trip. I think it's going to be fantastic to meet Libby, to learn from her insights and to learn just what it is that she gets so much from an opportunity like this. Really looking forward to the different culture, and I'm not sure if there's going to be so much about innovation, but maybe around improvisation or recycling is something I've heard could be really great to focus on. Body, mind and soul would be something that I'd be focusing on as well.
The main area of focus for our visit was the emergency medicine department at Muhimbili National Hospital. We were greeted by Libby White, who introduced us to the head of emergency medicine, Dr. JUMA MFINANGA. With a warm welcome, JUMA quickly pointed out just how valuable Libby was to him and his team, and he said that Libby teaches us a lot, and putting himself into that learning cohort was quite humbling and something that we'd see more of. Libby had prepared us for just how important greetings are to Tanzanians, and so it wasn't unusual for handshakes to linger for quite a long time, certainly more than what we might be used to in the West. And so without further ado, JUMA took us on a tour of the hospital, first of all to meet all of the senior leadership team, the executive team, to not only introduce us, but announce our presence and almost to kind of give us this unspoken blessing to proceed with our work and interactions with the rest of the teams. These introductory conversations were really insightful for all sides. When JUMA introduced us to Dr. FARAJA, he talked about how her main portfolio was dealing with the Libby issues or the Jared or de Villiers issues. So something that we learned in Tanzania through our experience moving through the airports was that oftentimes jobs were ascribed to people and not the other way around. Dr. FARAJA was proud to share the recently developed strategic plan for the hospital, and this would become a targeted conversation that the team would have over the coming week, just providing some advice and some feedback and some lessons learned from Alfred Health's perspective in terms of bringing a strategic plan to life. One of the things that became clear to me from the outset and was enforced was that filming and taking photos was going to be a problem. And although JUMA did extend to me some permission, it was more with a wink than with full endorsement. So I had to be careful and use a fair bit of discretion as I took my captures throughout our visit. With temperatures and humidity high, it was interesting how they used their architecture to create drafts throughout the hospital rather than relying on air conditioning. Sister Agnes talked to us about some of the challenges they're facing from a resourcing point of view. They have a critical shortage of nurses, and interestingly, it's the government that does the recruiting and also deploy higher skilled workers from main hospitals into regional centres. So they've had a shortage of skills and numbers for quite some time, and within the last 10 years, they haven't recruited directly to the hospital at all. With our greetings behind us, we made our way to the emergency medicine department to have a look around. And for me, it's interesting how some things remain the same no matter where you are in the world.